Good afternoon, everyone, and thank you so much for joining us today for the Boys Town Pediatrics and Newborn Expo. My name is Gabby, joined here today with Dr. Connie Schnoes and Dr. Caitlin Gillespie. And sleep, you can go ahead and leave it in the comment section of this video, and we can answer any questions throughout here. Okay, I'm just double checking our Facebook. Looks like we are live in there, so that is great. Hoping everyone is hopping on and finding our live. But perfect.
Most of that announcement blacked out.
Oh, did we cut out a little bit? That's okay. I can repeat myself here. So we are live for the Boys Town Pediatrics Virtual Newborn Expo, our Spring Expo. My name is Gabby, and I'm your host for the week. I am live with Dr. Connie Schnoes and Dr. Caitlin Gillespie. If you both would like to introduce yourselves.
I'm Dr. Connie Schnoes. I work at the Center for Behavioral Health. I'm a psychologist who works with children and their families.
And I'm Dr. Caitlin Gillespie. I'm one of the primary care pediatricians at Boys Town, located at the Maple Street Clinic.
Wonderful. It is great to have you both on. So like I mentioned, we are going live on sleep today. Dang, my coworkers. All right. I'm going to have to restart it because my coworker says she's not seeing it. I'm seeing it on my event side, but since I'm the admin, I might be the only one.
Gotcha.
Oh, wait. She said yes. She said
Yay!
yes. I appreciate you guys sticking with me. I know we've kind of gone back and forth. Perfect. Okay. I'm glad everybody can see it. Okay. Awesome. So if you are watching live and you have a question for this topic, leave in the comments. We're also doing a live giveaway. So if you just want to comment anything, say hello, let us know what you've liked so far about the expo. If you are pregnant and maybe haven't announced your pregnancy yet, you can always direct message our page, and that will also count as an entry because we know not everyone will want to comment. So, okay, let's hop right into these discussion questions. So the first one is, what should new parents expect their first few nights at home with a newborn? So Dr. Gillespie, if you want to start.
Awesome. Yeah. Gabby, I was really glad that we were covering this in our Spring Expo because I think it is a really big part of life with a newborn. So as a mom myself with a 4-month-old at home right now, I've been focusing on talking about this with my new parents in clinic as well, because it's a huge part of that transition home. And one of the things that I think is more stressful for families coming home. So I think that one of the most important things to know is just that newborn sleep is very different from our normal sleep. And so it's important to remember a couple of things about newborn sleep that maybe we don't necessarily know, which is that there are some general guidelines in regards to newborn sleep, but that all babies are different. So they're not cookie cutter. They're all going to do something a little bit different, and that's okay. So we can look at kind of rules and guidelines, but know that our baby is going to be unique. And that the second part is that it doesn't last forever and it does get better. So the sleep will change into what we consider to be kind of normal sleep patterns. It just takes some time. So without wanting to do too much information, I thought it'd be helpful to kind of go through the basics of newborn sleep in general. So this will be those first couple of days and nights at home, but that this process of what you're seeing newborn sleep-wise takes weeks, if not months, in order to kind of regulate itself. So newborns include babies. A lot of times we say 0 to 6 weeks, but it's really 0 to 12 weeks, that whole fourth trimester of when babies are doing a lot of growth and development. And what I think we all think of as babies sleep a lot of the time, which is true. They do sleep a lot of the time, but their sleep is in very short segments over the entire 24 hours of the day. So not like ours. Many newborns will sleep anywhere from 14 to 17 hours in a 24-hour period. Some are a little bit less, some are a little bit more. Typically about 8 or 9 of those hours will be during the day, and then kind of similarly at night. So split 50-50, but it does vary a lot from baby to baby. And while they do sleep a lot, especially in those first few weeks of life, very commonly they'll not sleep longer than a couple of hours at a time. Usually 2 to 3 is kind of the max that we see. So babies will typically need to eat every 2 to 3 hours during the newborn period, which averages anywhere between 8 to 12 times that they eat during 24 hours. Breastfed babies will typically be feeding more frequently than formula-fed babies as we're establishing breast milk supply, especially in those first kind of 4 to 6 weeks. So they might even demonstrate something called cluster feeding, which is periods where baby wants to feed very frequently in order to soothe and also to increase mom's milk supply. So sometimes that's every 30 to 60 minutes. That's not all 24 hours, but they will have periods where that might be happening, especially for breastfed babies. There's also a lot of variability in how babies are able to establish their day and their night cycles. So very commonly newborns will sleep longer stretches during the day and be more awake in the late evening hours. A lot of times that's like 8 p.m. to maybe 2 a.m. So times when we would say, hey, this is a normal sleeping time, not for our newborns typically. And you might hear this referred to as day-night confusion. This doesn't happen to all babies, but it does happen to a lot of babies. And it's really just kind of a developmentally appropriate thing that we see in terms of babies just becoming regulated with our day and night cycles. So some things that can be helpful, this does get better with time as we see circadian rhythms, so normal day, night develop, but that takes a little bit of time. And things that can be helpful during kind of the newborn period is maintaining day and night in our house. So when it's daytime, appropriate light, normal light cycles, normal things that are going on in the house. At nighttime, keeping things dark and quiet and low stimulation as we can. In the newborn period, we're kind of doing, we call it sleep survival. So we're thriving as best we can and getting babies the sleep that they need, and just kind of working through that. But those are things to focus on if we're seeing trouble with flipping days and nights. As our baby grows, the total amount of sleep decreases, but the length of nighttime sleep increases. And so a lot of parents will ask about sleeping through the night. What does that look like? So sleeping through the night is when babies are able to sleep a longer stretch, commonly 6 to 8 hours. And a lot of times that'll happen at the beginning of a night of sleep, where they then might wake up and then go back to sleep for a total of 10 to 12 total hours overnight. But very few babies are able to sleep through 10 to 12 hours overnight. So most babies can't do this until they're at least 3 months old. And sometimes you'll see weight averages of like 12 to 13 pounds, but there's a huge variability in this. About 2/3 of babies are able to sleep through the night on a regular basis by the time they're 6 months old. And again, that's a stretch of 6 to 8 hours. So not a whole night from like 7 to 7. And that is normal. Very commonly breastfed babies will be up 1 to 2 times overnight to eat through 6 months of age, and sometimes even longer than that. And that is normal. One other piece I want to touch on is just that newborn sleep cycles are very different than adult sleep cycles. They go through a couple of different cycles of sleep, like quiet sleep and active sleep. There's a lot of details and minutia in this, but I think the important thing to know is that for active sleep, it's similar to kind of our like rapid eye movement sleep cycles where we're like dreaming and things are going on. But as opposed to us, babies are very active during this period of sleep. And so I was not prepared for that as a first-time parent, but very active where they're kind of like cooing, crying out. They might seem like they're awake. They're opening their eyes sometimes even, or moving around, and you think that they're awake, but they're actually in just kind of a light stage of sleep. So something to keep in mind if you see your baby doing that, because a lot of times we don't want to rush right in. We want to see if they're actually waking up or if they might just be in active sleep. Another thing I think as a first-time parent, I actually asked my husband if there was anything I was missing, and he asked me to include this piece, that babies rely on their caregivers to monitor their sleep patterns and to help them get to sleep. So babies aren't born and just say, I'm going to lay in the crib here and I'm going to fall asleep and I got it. They need a lot of our support, and that is normal. New babies typically won't be awake for longer than 45 minutes, up to 60 minutes at a time. So they're not awake very long before they need to sleep again. And that is normal. So monitoring what we call sleepy cues can be really helpful in kind of predicting when a baby needs to go to sleep, in addition to just knowing that they can't be awake for very long. So common things you might see are kind of baby kind of staring off. They might be rubbing their eyes. They might be yawning before they get to a super tired phase where they're more crying and upset. That is usually the sign of a baby who really needs to lay down or who is already overtired. And sometimes it can be harder to get them to sleep if they've already kind of reached that stage. So in addition to kind of monitoring those things, babies often aren't able to fall asleep independently and need our external support. So what does that look like? A common thing that we'll refer to is the 5 S's of soothing. So swaddling or keeping your baby wrapped and close, either in a blanket or kind of a pre-made swaddle. Laying in the side or stomach position in your arms can be comfortable for them. Like shushing or having white noise sounds. So either you're shushing in there or have a white noise machine. Swinging, so babies like rocking, bouncing, movement because they're used to movement from when they were in your belly. And then also sucking. So that can be either feeding or that can be introduction of a pacifier if it's appropriate with established feeding. So all of those things kind of go into getting your newborn to sleep, where they rely pretty much on you to do that, especially in the early days. So that's a lot of information. So just to kind of wrap up on that, expectations would be that we unfortunately expect to be tired and we catch up on sleep anytime our baby is sleeping. You hear that all the time. I feel like sleep when the baby is sleeping. You say, okay, like the baby's never sleeping, but it's very easy to get caught up in the little things when you have downtime. But in the first few weeks, it's crucial for parents to make sure they're not getting behind on their own sleep because it can take a significant toll on our mental health and just our processing in general. So if baby is sleeping, that means we're catching more naps and getting probably more sleep during daytime hours than we're used to getting, but that's what keeps us caught up. Second expectation is just that there won't be any kind of schedule for a while. This does get better, but babies are unpredictable and they'll operate on their own timeline very commonly for the first 8 to 12 weeks. Like we're kind of just living in baby's world there for a little while. And you might notice trends over time, but very, very frequently babies are going to eat every 2 to 4 hours and they're going to take frequent naps that can last anywhere from 30 minutes up to 2 or 3 hours. And you don't really know when they're going to be hungry again or when they're going to want to nap again. And so we offer those things as they're appropriate, but there's not going to be a schedule for a while.
Yes, thank you for such detail. We really appreciate you going into those details for that answer. Dr. Schnoes, do you have anything to add before we go on to the next question?
No, Dr. Lesby, you were very thorough. Very thorough. I was waiting for the sleep when your baby's sleeping because with that frequent napping, you're not going to get a 6-hour stretch of sleep as the mama either if you're nursing. If they're bottle feeding, then maybe mom and dad can work it out so somebody takes a feed so they get some longer stretches in there. But it's really important to get that sleep when you can.
Yes, I don't think that was something I fully appreciated until I became a parent myself, but it is something that is super important, definitely in the first 2 weeks, especially while we're establishing breastfeeding, just because it is very easy to get behind. And that was one thing I was not prepared for, I think, as someone who had a first baby as a third-year resident. I was like, I'm used to overnight shifts and 24-hour shifts. It is not the same. Not the same.
Yeah. Okay, the second question here we have is, where should my baby sleep when they are a newborn? Dr. Lesby, if you want to start, and then Dr. Schnoes, feel free to add on.
Yeah, absolutely. So a lot of what we say in terms of safe sleep recommendations come from the Academy of Pediatrics. And so they actually updated their safe sleep recommendations in July of 2022, so less than a year ago. So a lot of what is in there, if you were to look into that, they have a policy statement that's available online as well in terms of where those recommendations are coming from and why. But a lot of those things are similar to what was previously included in the policy, just a little bit more clarification and guidelines in terms of what they consider safe sleep and what risk factors would be. So the goal of the safe sleep recommendations that we talk about is a reduction risk of both SID, so sudden infant death syndrome, and any other sleep-related infant deaths. That's the whole point behind these recommendations, is preventing this as much as we can. So those recommendations are based on data from patients that are 1 year and younger. So this is all data that is pertaining to babies less than a year of age. But as far as the American Academy of Pediatrics and then pediatricians in general, we recommend closely following the safe sleep guidelines as closely as possible. Sometimes we'll refer to those as the ABCs of sleep. And so the A in that is alone, where babies should be in their own sleep place with no other people around them. They should be placed on their back in their safe sleep space. So not on their belly, not on their side. And they should be placed in a crib. So crib is kind of meant to define what that safe sleep place is, which is a firm surface. So a crib, a bassinet, a portable play yard with a firm, flat, fitted sheet on the mattress. We want to avoid sleeping on any soft areas like chairs or seating devices, anything like that. And we want to keep any loose things out of the crib where baby could pull them over their face. So blankets, pillows, stuffed animals, bumpers, anything soft that could be moved over their face. Those are the key guidelines in what we're calling like a safe sleep environment. I think one other thing to note, because I do talk to families about this in clinic too, is that the AAP in their new kind of policy guidelines does give their recommendations on bed sharing. And so bed sharing would be considering, especially I think for a lot of families that are doing breastfeeding where the baby is in the bed with the parents. So the AAP acknowledges that a lot of families choose to do that for a variety of reasons, like facilitation of breastfeeding, for cultural reasons, beliefs, preferences in general. So they acknowledge that that's the case. Based on their current available evidence, they would be unable to recommend bed sharing under any circumstances. So just knowing that in terms of risk factors that are available, it's not recommended, but acknowledging that there are many reasons why families choose to do that. So in terms of kind of risk assessment with bed sharing, the AAP has outlined things that are more risky than less, or like bed sharing in general is going to be at higher risk for those things, like SIDS or sleep-related death, than not bed sharing and following the ABCs. But there are some other things that they've included in their policy statement. If that's something you're interested in reviewing, if you're thinking about bed sharing or have questions about it. One other thing I just wanted to include was I feel like a lot of parents have questions about naps and daytime sleep. So lots of parents typically want to know where their baby should sleep during the day. If your baby can sleep in their nighttime sleep space for naps as well, that is perfect. That's great. If they will do that for you easily, awesome. I will say a lot of babies won't easily sleep in their crib or bassinet right away when they're little. And there are normal reasons for this. Like they are used to a close, warm environment with lots of motion in your belly, and transitioning to the outside world is very, very different for them. And so most infant loungers, rockers, swings will come with warnings that you should not have your baby sleep in them. This is true. However, for the most part, this is typically the case with unmonitored or long periods of sleep. So we shouldn't put a baby to bed in one of those things. However, at home, it's typically okay if you're close by and monitoring your baby so that you cannot be holding your baby while they sleep so that you can get other things done or sleep safely yourself. So if you have questions about that, definitely reach out to your pediatrician and ask those questions. But kind of like we talked about, your sleep is very important. And I think one of the things parents see when they come home is realizing how heavily their baby relies on them physically and emotionally in order to be able to sleep.
Gabby, when I read that question, Dr. Gillespie, again, great information that you're providing. My head went to what room should they be in? And I know lots of new mamas keep their babies in their bedroom with them and then at some point transition them to a separate bedroom. It's been a long, long time since my babies were babies. What's kind of the current recommendations around how long to keep a newborn in your room, or does that even exist?
Yep. Yeah, that's actually, so that was actually one of the questions I think we have coming up too. So that's a great follow-up question because that is part of where should they sleep? So the AAP recommends room sharing. So rather than bed sharing, room sharing, where the baby is in the same room as the parents for the first 6 months of life. So that's keeping the infant's crib or play yard or bassinet in your room in close proximity. And room sharing without bed sharing has been found to be protective for the first year of life, where it can decrease the risk of SIDS by up to 50%. It also allows for close proximity to the infant, which helps facilitate feeding and comforting and monitoring closely during the overnight period. So there's not specific evidence that they found in terms of when it's safe to move to a separate bedroom before a year of age, more just kind of risk reduction, especially in that super sensitive period of the first 6 months of life. So those are the recommendations from the American Academy of Pediatrics. However, I think what we know is that it also kind of relates to best fit for your family. And so there are a lot of reasons why a family might move their baby out of their room before 6 months of age. Mm-hmm. One of the major ones I feel like is poor parental sleep due to the presence of the infant in the room. Like we said, babies are very noisy sleepers. Mm-hmm. Sometimes that doesn't really bother parents, but for sometimes, especially for first-time moms, like you hear every single noise that they make and you wake up even when they're fully in asleep, but they're in active sleep. Another one is the infant might outgrow their bassinet or their safe sleep space. This is what happened to us. My 4-month-old is way too big for his bassinet already. And so moved him to the crib. And there might be a variety of other reasons too. And I think the key takeaway is just that babies should be in relatively close proximity, so monitoring is available in addition to safe sleep recommendations. So whether that's right next door in the room with the door open, or a newborn monitor there at your bedside so you can hear them if they are making noise. Like, we want to make sure that monitoring is appropriate.
Perfect. And I'm seeing we're getting a lot of questions coming into the comment section. Thank you, everyone. Know that we have set time aside here at the end for a Q&A, and we'll try to get to as many as possible. Okay, the next question here is, how can I help create positive sleep associations? Dr. Schnoes, if you'd like to start.
So Dr. Gillespie actually already hit quite a bit of this information as she was talking about when babies are born, they don't know how to fall asleep. And so we need to help them learn to fall asleep and help them settle. And the 5 S's, I'm not going to be able to give them back to you, but there were 5 S's. And so for babies, for small children, it really, the whole point really in having a routine or a process is because we learn how to fall asleep. And so you're teaching that baby how to fall asleep. And so you want to include in that routine things that lead to falling asleep. And so if it's, their diaper is clean and dry, they've been fed, and now it's low light, it's low noise, low stimulation, and you're helping them to fall asleep. Ultimately, the goal would be to get them close to falling asleep and put them down so they can fall asleep on their own. So you're not putting them to sleep their whole life. There are situations where that happens. They're much older and they're still not able to fall asleep by themselves, but creating those opportunities and being consistent with that will help the baby. For newborns and very young children, again, they're napping a lot, so there's lots of opportunity to help facilitate that sleep onset process in a very consistent way. Dr. Gillespie, anything you would add?
No, kind of like Dr. Stroh said, our goal, I think, especially as they're younger, and I know this is our newborn expo, so we're talking about newborn expectations. But I think very quickly with a new baby at home, your brain goes to, but like, what about 12 weeks from now when this isn't the case, when they will be sleeping better? Like, how do I best help them? And these are the kind of things that it's never too early to set the stage for good sleep. And so we kind of talked about that with day, night cycles where, if we're supposed to be awake, the light should be coming in. We should be doing our normal things, washing the dishes, vacuuming, doing things that say, hey, it's daytime. And then for night, even if we are up and fussy, or even if we are up and needing to eat, the lights are low, it's low stim, we're kind of signaling to baby it's nighttime. And then trying to do the same. It's less, I feel like, important when we're kind of still in that 0 to 6 weeks, but around the 8-week mark, as long as we're things are going well, we can be like, hey, we have our white noise machine, we have the dark room. Sometimes I guess I didn't speak about this specifically, but blackout curtains, depending on what your room looks like, is a great positive sleep associator. Say, it is dark, it is time for us to sleep. Here's our soothing environment, because that can be tricky for babies too. But yeah, just setting the stage for them to know it is sleep time can be really helpful from the get-go.
Let's talk bedtime routines. What should we do for those?
Well, I'm thinking about this whole newborn focus. And so it's not really, it's going to be the parent's routine with the child, not so much the child's routine, because as right. Really is the parent's routine. So again, ensuring that they are dry. I know at this point with my grandbabies, part of that routine is a sleep sack. So they're in their sleep sack. Doesn't matter if it's a nap or if it's nighttime sleep, depending on, how newborny they still are. So that's part of the deal, but dry, fed. And again, if they are a pacifier baby or need something else, just the rocking, the motion to help them go to sleep. I would not encourage playing music for them to fall asleep by, or having twinkle lights on the ceiling. They are learning how to fall asleep from the very beginning. And so whatever you're including in that process, they are learning. And things like music, white noise is great. Dr. Gillespie's talked about that a couple of times, but music or other sounds or story time, anything like that is not the same level of quality of sleep for babies, because it's requiring more brain interaction than we want. White noise is a stable, steady sound, and we don't have to react and alert to that. So the dark, the quiet, anything you want to persist so this baby can fall asleep in an independent way, ultimately.
Yep. And I absolutely agree. So parents will a lot of times ask like when to start a bedtime routine. Again, it's never too early to start one. And when we're calling it a bedtime routine, that's like a very like loose phrase for like, what does this look like? It does not have to be, a 30-minute thing that we're doing. Like Dr. Snow said, consistency is the key with a lot of things that we're talking about for newborn sleep. So something that's going to help your baby anticipate that it's time to be laying down even before we're laying down. And so I agree that for feeding, a lot of times what I will recommend is trying to separate eating from sleeping, especially as we're getting older. When we're newborns, it's very hard to do that. A lot of times they'll fall asleep eating, and it's okay. It is what it is. Even as they get a little bit older, it's not hurting anyone. It just becomes a question of, will they expect every time that they're falling asleep that they need to be eating in order to fall asleep? That is something we can work on if that becomes a problem, but I don't worry about that too much. For us personally, it's we eat and then we go and we change into jammies and diaper, and then we get into a sleep sack. So sleep sack or swaddle, because that kind of signifies, hey, we're winding down, it's getting ready for bed. Rocking, maybe singing or reading a quick book, and then lights out, listening to the white noise and going to bed. Some parents like to incorporate a bath into that routine. That is great. For little ones, a lot of times we're not needing to bathe every night, so 2 to 3 times. So you can incorporate that at the beginning of the routine, but you don't routinely need to bathe every night. Sometimes infant massage is a question I get asked. I've never done that, but there's a lot of good resources about how to do that to help your baby wind down. But the main thing is you want to do the same things in the same order to help your baby anticipate that it's time to lay down.
The other thing I would add too is those, you mentioned the sleep cues earlier. Like it really is learning those cues, because that's when you're going to initiate whatever your process is for newborn. Like that's just what you're going to do.
Yes.
Awesome. The next question is, what are some things I can do to try and get my baby to sleep for longer stretches? Dr. Snows, if you'd like to begin.
That really is a developmental progression sort of thing. And all babies are different. And so how soon they'll start putting sleep together in longer increments, you're just really going to have to watch the baby and see what they do. The things we've been talking about, like having the blackout curtains, having white noise, those things will help facilitate the baby sleeping longer when they're ready to, because they won't have to alert to too much light coming in their window, or some sound isn't going to alert and startle them. Even the following recommendations to have them sleep in their own space. So somebody else moving or, something else happening in the room isn't what's disturbing their sleep. So creating an environment that allows them to sleep as long as developmentally they're ready to do is going to be the most important thing to ensure that they're sleeping longer.
Yep. And I absolutely agree with that. I think one thing for newborns that sometimes parents, when we're talking about cues, like we talked about, again, as a first-time parent, did not realize how important, how much of my life would be looking for my baby's tired cues, but it's a lot of my life, and my toddlers, honestly. But one of the things I think that maybe as I learned more about newborn sleep that I wasn't really, I guess, getting right away was that just because the baby wakes up in their sleep space doesn't always mean the baby's ready to get up. It may mean that the baby just needs a little bit more external support from you, whether it was something that you did while you were getting them to sleep that no longer is there. So a common one is like a pacifier. You use that pacifier to get to sleep. You got to the end of a sleep cycle, the pacifier's fallen out. Where is my pacifier? If we're trying to extend a nap, even just going in and quiet patting and replacing the pacifier can help that baby sleep for another sleep cycle of another hour or so. Mm-hmm. So if you go in and your baby is wide-eyed, smiling at you, it won't be in the newborn period because babies regularly won't be smiling until 6 or 8 weeks. And that is but if you go in, you're like, clearly this nap is over, then the nap is over. But for a lot of them, like if you are just kind of like, shh, here's this thing that you had that you need, they might go back to sleep for you. So not interpreting those cues inappropriately on our end.
Mm-hmm. Yes. So we're getting a lot of questions about sleep training. There are a lot of sleep training methods out there. no cry sleep training, Ferber, etc. And it can be controversial. So some people have very strong opinions about sleep training. So what do you guys think of it?
Yeah, I mean, in terms of like actual recommendations, sleep training is not a hard and fast rule for babies in general. So you do not have to train your baby ever if you don't want to. Kind of like Dr. Snow said, there's developmental milestones and progression of sleep that we expect to happen with time as babies get older, as long as we're setting them up for success. So you never have to do that. So the decision to sleep train is kind of a parent and family decision, a personal decision. And as a pediatrician, my goal is always to be supportive of your sleep goals as long as they are developmentally appropriate and safe. So not like pro or against, really. It's just kind of, well, what are you guys seeing? What are your concerns? How do you want to achieve this? So in terms of sleep training readiness, typically that's going to be between 4 and 6 months of age and not before. A lot of the things we've already talked about in terms of babies are not developmentally ready to sleep train or sleep independently before that. And 4 months is even still a little bit on the earlier side. Some babies will be able to do normal sleep stuff by that age, but by 6 months, most babies are able to self-soothe and get themselves to sleep. So you want to be old enough, because otherwise we're not really being realistic in our expectations that we're asking of your baby. So like we said, this is considered a sweet spot developmentally of when we're learning those self-soothing behaviors, when we're capable of doing it, and when we're starting to connect sleep cycles so that we can have longer stretches of sleep. So what we really need is the ability to also go multiple hours without eating. Now, you don't have to be sleeping through the night, fully sleep trained, or fully off nighttime feeds in order to do this, but some parents prefer that. So it's not confusing when they wake up in the middle of the night of how we're going to respond. Are we going to respond by going in? Do we need to eat? It's confusing. So there's not one specific way to sleep training. So the goals overall, when I talk to families about this, are to pick a method that you're comfortable with is the most important. So like Gabby kind of already alluded to, there are a lot of different options and plans for how you want to do this. I don't think very many people these days would recommend your like traditional cry it out method. I don't think very many parents are comfortable with that. So I really don't even talk about that with families. But otherwise, there's a lot of flexibility in how you choose to sleep train. So I think kind of we've already touched on this. Consistency is the key if you decide you are going to sleep train. So whatever you decide that you're going to do, for it to be effective, you need to be consistent in how and when you're responding to your little one when they wake up. So that is kind of goes into like the plan that you pick. Like, is this feasible for you to implement consistently so that they understand kind of what is going on while we're sleep training them? Typically that's related to when are you going to go into soothe? How do you soothe them? And at what time intervals are you going to wait before you go in and intervene if they're still not falling asleep on their own?
When I'm working with families, and it's not typically with newborns because they're not eager to sleep train a newborn, and as Dr. Gillespie is describing, it's not really appropriate timing, really. I mean, you're already training, if you will, because you're teaching your child how to fall asleep. But you're ultimately working to help them learn to fall asleep independently. And I think that's where the training part comes in, is when parents realize, oh, wait, I am rocking to sleep or I am feeding to sleep and I don't want to do that anymore. So the development of the baby does matter. What they can do, though, in that process is as their baby is falling asleep and they're ready to lay them down, they can jostle them just a little bit so they're not sound asleep and lay them down so they're sleepy but just a little bit awake, and they're able to finish falling asleep on their own at that point. So you're not putting them in the bed like wide awake, in 20 minutes fall asleep, put them move, but you're getting them close to sleep. And so you are fading how much the parent is doing to get them all the way to sleep, and then putting them down and letting them finish that off themselves. And you'll just take your cues from your baby on, did you get them far enough? And then very gradually back that off.
Yes, we have quite a few questions in the discussion. So I'm just going to ask one more on my list, and then we'll hop into the Q&A here. So could you please talk about some of the signs that might mean that baby is not sleeping so well? So underlying issues like ear infections and teething.
Yeah. So, and we've kind of touched on just like the normal development piece of the newborn phase and then even infant sleep. So there are a lot of different things happening in those first few months of life that present sleep difficulties, even if there are no other issues, illnesses, anything going on. So I think it's important for new parents to hear that. Like, this is kind of a difficult process. It takes time. There's not a quick fix. It doesn't necessarily mean that anything is wrong, especially if it's in that first like 6 months of life. However, what you might also hear about are like sleep regressions, which really are more like sleep progressions. Developmental leaps is kind of what we like to call them, where your baby might be learning new skills or their sleep cycle is maturing. All of these things are good overall, but they can lead to new challenges for several days, up to several weeks, even in someone who seemed like they were making progress in terms of those sleep milestones. And so really, I tell parents in clinic, like, you could Google any month and sleep regression and something's going to come up that says there's a sleep regression at this age, because babies are all different and they follow their own timeline. And so someone's 3 month might be a 4 month, might be a 5 month. But there are some key times during development where you do see some of those things happen. So if you do notice something changing and you're like, ooh, I wonder if they're sick. Ooh, I wonder this. But you notice like, hey, we've actually started rolling recently, or any of these other big milestones, that's probably what's going on, is just baby's brain is growing and developing. So it's a good thing overall, but just maybe a little tough for sleep in the kind of now immediate future. In terms of like sick stuff, ear infections for sure can make babies fussier, sleeping less well. A lot of times that'll be accompanied with, other symptoms like cold, cough, low-grade fevers or other fevers. So if you have other symptoms of illness along with a change in sleep or poor sleep, that's a reason for you to reach out to your pediatrician and make sure that there's not something illness related. In this respiratory season, ear infections have definitely been a problem, but so has just congestion, colds, because babies breathe through their nose. They're not mouth breathers. And so if their nose gets stuffed up and they can't breathe, that's going to make them wake up a lot more frequently overnight. So that's something to keep in mind. Teething, we get a lot of questions about teething. Teething, if we truly are teething, can definitely make your sleep more difficult. I was actually just talking with someone about this morning who had a teething baby. And as someone who got my wisdom teeth in college, I know that doesn't feel good. So if that's happening, then that can certainly make changes in our sleep routine overall. And there's really, that's kind of supporting baby through that with giving them appropriate things to chew on, silicone-based things, cold things. You can also use pain relief medicines, especially before night if they're uncomfortable and not able to relax out. A lot of times for teething, if parents have questions about that, one thing I will mention is sometimes we get that question at 4 months of age because babies tend to start drooling a lot more. A lot of times that is not teething. It's just babies getting ready for significant oral motor development. Everything is going in the mouth. That's how they're sensing the world, and they're getting ready for progression of starting to eat solid foods in their diet. A lot of drool does not necessarily mean that teeth are coming in. Sometimes it does, but a lot of babies aren't going to develop and pop their first teeth right here at the bottom until around 6 months of age. And sometimes that's up to 10 months of age. So if it's 4 months and we're worried about teething, that's probably not what's going on. But if you ever have any questions, your pediatrician is happy to assess that and kind of talk through those options with you.
I was thinking too about difficulties with digestion, especially in newborns, because it's hard to know if they're going to have allergies or not. So lots of spit up or irritability or.
Yeah, for sure. My husband actually, it's so funny. I was bouncing ideas off of him last night. He's like, are you going to mention newborn gas during this talk? And I was like, I don't think there's enough hours in the day to mention it during this talk. But Dr. Schnoes brings up an excellent point where newborn gas and the GI system during that first 6 to 12 weeks, again, very normal infant things happen that can be stressful for parents and typically get better regardless of anything that we do, just as they grow and develop. But if you ever have questions about that and how it's related to sleep, that is another great thing to follow up on with your pediatrician in terms of monitoring that.
I'll have to add that to the list for the fall expo.
That's a talk in and of itself, honestly.
Awesome. Okay, so I have my questions coming through here. I'm going to go ahead and read some. I'll try to get to as many as we can. Dr. Gillespie and Dr. Snows might have to hop off to see patients, but we'll try and get through what we can. So this one's good, just about external factors with a newborn. So what are some tips for sleeping families with dogs, like if their dog's barking a lot while their baby's trying to sleep?
Oh.
That's a great question. This kind of, I guess, goes back to kind of what Dr. Schnoes was saying too. Like we create that sleep environment in hopes that it becomes kind of like a sleep bubble for the baby so that things going on outside of that sleep bubble aren't popping it essentially. So we do our best. I don't have a dog, but I do have a toddler. And so it can be very similar some days where there's a lot of outside noise from the room that might be getting its way in. But kind of the same recommendations, like a good white noise machine, something that I think one of the things I guess to keep in mind too is your noise machine. There's like a specific decibel range that is recommended for good white noise. I believe it's like 60 decibels. But I feel like more often than not with a baby, we're like, oh, we don't want it to be too loud. And that white noise actually might not be loud enough. And so it's not creating that environment. So that's something to keep an eye out for. But I have white noise for both my toddler and my newborn. And actually after having it in our room when we were doing room sharing, my husband and I are like, we sleep way better with this on. And so we have a white noise machine now too. So that would be my primary recommendation for trying to like cushion the sleep space from those outside stimuli.
Awesome. How many naps or hours of daytime sleep is normal?
Well, that's completely dependent on the age of the child, and that shifts very quickly.
Okay.
It does. It's a hard, this is in keeping, I think, with newborns in general. Like they're going to keep you on their toes. Once you have them figured out, you think you have them figured out. And the next week, their schedule that we talked about, it's a loose schedule where you're like, okay, they generally go this long in between feeds and they generally will take this many naps, but it changes and it does change very quickly. Kind of over the course of like really in that 0 to 6 week mark of newborn life, like it's just kind of a free for all. We're sleeping and eating at all hours of the day. And that just kind of is what it is. After that, you might see some change where a lot of babies, rather than being like 14 to 17 hours, a lot of them by the time they're kind of up to 6 months of age are going to be averaging closer to like 11 to 14 hours. But it really depends. Some babies sleep more. Most babies are sleeping at least 11 hours during a 24-hour period of time. But depending on the baby, some babies are going to sleep just 10 hours of their overnight sleep. Some will sleep up to 12 of their overnight sleep. For the ones who sleep longer overnight, sometimes they're sleeping more during the day. And even on a day-to-day basis, you don't necessarily have the same amount of naps. Like right now, for example, at our house, we're just over 4 months. We have 3 nap days and we have 4 nap days. And it kind of depends on when we got up and how long the naps lasted and how long it takes us to get back to nighttime sleep. And so it is variable. You can usually see general patterns of how things are trending. But especially after that 6 week mark, you're going to be more like 5 naps. And then you're going to be in like a 4 to 5 nap area. And then you're going to be in a 3 to 4 nap area. In general, I would say the one that you can kind of like hang your hat on for a lot of babies is you're going to be closer to 2 naps a day around 1 year of age, like 9 to 12 months. And then usually sometime between 12 and 18 is when you're going to drop one of those naps and then have 1 early afternoon nap. Like that's the most consistent time, I think. Yeah. But yeah, it's a lot of just kind of monitoring. And also, like we said, reading your baby's cues of like, how well do they do with this? Do they seem well rested? Are they super cranky? Maybe we need to adjust some of this. But yeah, that scheduling piece, I joke about this after just coming back from maternity leave. You know, you go back at 12 weeks and there's still not even the hint of a schedule to tell a caregiver, like, this is what my baby does.
Yeah.
Good luck. This is what we do. But yes, we have all those skill sets. It's just that the schedule, it's a loose interpretation.
Right. The next one is when does not sleeping through the night become a problem or something that we should talk with about our pediatrician? Is there like an age frame?
Well, my head goes first to not sleeping. Well, there's a couple of things my head goes to. Nobody sleeps through the night, number one. So a typical sleep-wake schedule, we come to a waking state multiple times in the night, children more frequently than adults at the end of sleep cycles. So we wake up. The part where it becomes problematic for parents is typically for a little bit older kids and not newborns, but maybe some parents want their newborn to be sleeping too. That's just not realistic. But is if the baby can't really put him or herself back to sleep, then they're going to alert and need the parent to come in and intervene. So I think about a couple of different things related to that. One would be, how old is this child? Because babies need their night feed on average through 6 months of age. But after that, healthy, typically developing babies can go without a night feed. And so if they're waking to feed, but they don't actually need the feed, that's a different story on how you would manage that. The other thing I think about is what do they mean sleeping through the night? Because if they're looking for a 10-hour sleep window, that's an unrealistic expectation, really, for most children. So there are certain ages and stages where you can get that window, like Dr. Gillespie was talking about, but especially for napping kids, that's really unlikely that they're going to give you 10 hours overnight. You're going to pick up the balance of sleep and naps. And so it's how that is defined. But for an infant, I wouldn't even, a newborn, I wouldn't expect sleep through the night. Like I just wouldn't. So.
Yeah. And sometimes I feel like I have gotten that question from families in clinic, or sometimes we'll be just talking through, like, that's one of the routine things I talk about during well exams with families is, how is sleep going? Do you have concerns? And so kind of like Dr. Snow said, it's dependent on the age of the child. One of the things that I kind of take the lead on from families though too is like, if you're happy with it and it works for your family, I'm not concerned about it. There are sometimes when families will ask to, what could we change? And kind of like we talked about, some of those are more environmental associations that we have of like, I want caregiver here at the bedside and I fall asleep as long as they're here. So we talk about ways to approach that. One thing that you'll see in the toddler age sometimes is we go to sleep okay, but we wake up and then we can't go back to sleep in our room. We need to be at parents' room. And so we just talk about the main thing. It's not concerning to me if it's not concerning to you, because it's not going to harm your child. But when we talk about how we want to make those transitions, especially from a behavioral standpoint of like phasing support out, consistency again is key. And sometimes it is not realistic. We're not at a stage in life or schedule where we feel like we can consistently implement something. And if that's the case, then I tell parents it's okay. And we can wait until it makes more sense to do that. Not trying to make anyone miserable or super sleep deprived. Sometimes we just have to kind of roll with the punches with our kiddos and address problems when it makes sense to, if at all.
Mm-hmm. We got a couple questions on feeding during the night, waking baby up to feed. What would you recommend for that?
In terms of newborns, if we are having to wake to feed, I would, as a pediatrician, probably want to know about that. More often than not, your baby is going to wake up and tell you it is time for me to eat. Very frequently, especially in the newborn period, like babies are going to be up every 2 to 3 hours, even overnight if they've fallen asleep. And that is appropriate for them to be signaling that they need to eat. Their stomachs are very small. They don't hold a lot of volume. For breastfed babies, kind of even in addition to that, their breast milk content is a little bit different. So sometimes they metabolize a little bit differently and need to eat more frequently. And some of that is also dependent on maternal milk supply. Like we're establishing how much milk is there really for the first 4 to 6 weeks, definitely in the first 2 weeks of life. And so baby waking up frequently to eat and say, I need more food is what is driving our breasts to make more milk. And so it's important to respond to those cues appropriately. After baby, a kind of a general rule of thumb, again, a lot of variability, but most babies are waking pretty frequently the whole 24-hour cycle to eat, regardless of us waking them or not. What our goal is for babies to be back to their birth weight by 2 weeks of age. In that time during the 2 weeks, we don't want babies going longer than 4 hours without eating. 3 to 4 hours. 4 is the absolute maximum. Once they get back to their birth weight at that 2-week mark, if they're demonstrating, hey, I've been cueing and showing you I need to eat enough that I'm back to my birth weight, after that, we kind of loosen the reins and say, if you can give your parents a 5-hour stretch, that is great. I would love for you to get a 5-hour stretch. But I will say that is not always a realistic expectation. A lot of them are still going to want to eat like every 3 hours.
3 to 4.
Yeah. Well, before we draw for the giveaway, I just want to say thank you, everyone, for leaving all of your questions. I know we weren't able to get all of them answered, but I'm hoping, in the 50 minutes we've been talking that we were able to give you good insight. So before we draw for the giveaway, I want to ask Dr. Gillespie and Dr. Schnoes, how can people watching get in contact with you if they want to build on this conversation, maybe request a free meet and greet or an appointment with you at the Behavioral Health Center?
I think we're both accessible on boystownpediatrics.org because our behavioral health services page is on that website. So get to the center there.
Yep. And then I mentioned this at the beginning, but I'm located at the Maple Street Clinic, which is 168th and Maple. You can call our clinic if you have any questions about me. We're doing meet the doc visits here in clinic with myself and my 2 partners, Dr. Emson and Dr. Wilcoxon, and we're all accepting new patients. So all you have to do is call our front desk and they can schedule you for a free appointment to come and chat with us and see the clinic and kind of go from there.
Yes, that's perfect. So my coworker she's getting all the names entered. I'm just waiting for her here to send us the wheel. So we'll hold on just a minute for that, and then I'll show you guys the winner. If you have missed any of our previous presentations, we've gone live every day this week. So noon Central Time, we'll be live tomorrow for one more. And that will be how to figure out your parenting style. So we've talked a lot about, the newborn things, but some feedback we get is, okay, I feel like I was so ready to have a newborn, especially after watching these presentations and learning so much about newborn behavior and everything like that. But what about when baby gets a little bit older and it becomes, Dr. Gillespie, I know you're in it right now with toddlerhood. Yeah. So, okay, I know how to take care of this baby when they're immobile and don't talk, but what about parenting? So we're going into that tomorrow with Dr. Orr, and it will be a great talk. So I'm hoping you all can tune in for that. Okay, looks like we've got the wheel. So spin it. This is like my favorite part. I just love to. Okay. So,
That way.
Stasha, there you go. You are our winner today. So go ahead and send us a message with your email and you'll win 1 free month of music classes with our friends at Kinder Music and Overton Studios. We're also doing a giveaway tonight at 6 p.m. We have a reel going out on Facebook and Instagram. So you can comment on that and you'll have another chance to win, as well as tomorrow's live and our grand prize giveaway of a photo shoot with Nikki McLife Photography. That's going to be on that RSVP form that's linked above this video. Just make sure you have that filled out and you'll be entered to win. So Dr. Gillespie and Dr. Schnoes, thank you so much. I know this talk definitely helped me, helped plenty of people watching, so we really appreciate it.
You're welcome.
Absolutely.
Awesome. Well, we'll see you guys tomorrow at noon and have a great rest of your day. Bye-bye.
Bye.